In the modern care environment, where technology and medical practice is more innovative and advanced than any time preceding it, we as care professionals are bombarded with endless duties and patients seeking medical intervention. Finding time to invest and sift through patient symptoms to find the individual experience underneath the illness has often in the past been cast aside in favour of symptom treatment then discharge process. Often, this left patients feeling underwhelmed and undervalued in their interaction with the healthcare system. In many instances, patients relapsed into their illness because of external factors such as social and economic determinants of their health were not initially considered and continue to play a significant role in their wellness. Patient-centered care is a way of treatment that considers individuals, families, and communities as beneficiaries of a healthcare system which can both be trusted and relied upon to respond to their needs and preferences humanely and holistically. To provide care comprehensively with individual patient welfare as paramount, the practitioner must aim to know the patient as an individual, understand their health situation and what that means to them, and understand and respect their professional boundaries. It additionally involves including families in the care of their loved ones and collaborates with them to understand the needs of the patient from the perspective of those who know them best. Patient-centered care also aims to address foundational flaws in the systematic delivery of attention from the nurse's perspective. When providing respectful and safe care, it is crucial that nurses maintain a strong healthcare team relationship and communicating while working together to deliver high-quality, considered treatment. Collaboration is vital to introduce quality and safety to the client as we begin to understand that emotional care of patients, in some circumstances, may be as more important as their physical state. Introducing patient-centered care into the core of nursing practice helps elevate a healthcare system out of an environment based on purely symptomatic treatment to one that gives power to the consumer by placing value on their contribution to their health. The person-centered nursing framework, which is integral to the introduction and maintenance of this newly introduced care process, was developed by McCormick and McCann's 2006, was comprised of 4 distinct but interconnected constructs. The first construct refers to a set of prerequisites. The prerequisites focus on the attributes of the healthcare provider and identify which behaviours are crucial in delivering the comprehensive, emotional and physical care needed to achieve the best care outcomes. Example of the prerequisites including being professionally competent, having developed interpersonal skills, and being committed to the practice. It has been recognised in the care environment that staff work within, one which can be impacted by individual reflection upon these prerequisites can dramatically affect both their inclination and ability to care for patients. Following from this care environment is the secondary construct, which focuses on the context in which care is delivered. This includes both the physical environment the patient is exposed to or has access to, and the systems in place which facilitate shared decision-making between themselves, their family, and the practitioner. One way family-centered care has been very recently incorporated into the health system as a close partner to patient-centered care is in instances when a caretaker or parent falls ill and their children need supervision. A provision for family-centered care was believed to have been introduced in the 1980s in America when considerations had to be made in the improvised health care of women with children when they couldn't leave the hospital. This example of family implications of health is still widely felt throughout the community and is just one of the cases which arises frequently and which family can contribute to the patient's continuity of treatment. Cultural safety is the 4th construct and in treatment and practice is vital to delivering patient-centered care. Patient-centered processes focus on working with the patient's values and beliefs. Each individual's values and beliefs are determined by a vast array of social and cultural determinants of health, and as a practitioner, recognizing and placing value on these intrinsic differences is crucial to delivering safe and respectful care. The 4th contributor is expected outcomes. Expected outcomes address the desired results of treatment through effective person-centered approach, the core component of the framework, as well as satisfaction with care and involvement in care. The 4 contributors and the components associated with them in the framework are interconnected. The relationship between the contributors shows that to create positive results for both patients and staff, which is necessary for the propagation of patient-centered nursing practices, healthcare professionals must be vigilant to be continually adjusting their environment and practice to suit individual and must also take account of the prerequisites to address their practice. The focus of this presentation is exactly that, the prerequisite of feedback and its necessity, effect, and foundation within the nursing practice to develop patient-centered nursing practices better. Feedback has been at the core of professional growth in all major industries of the world for thousands of years. Feedback is crucial when relaying and processing information concerning individuals' behaviours and business performance. Within the medical sector, there has been a recent shift in the role of nurses, where in the past nurses have received commentary solely on their application of medical assessment and medicinal administration strategies. They now have to contend with delivering the same care in a way that empowers the patient and cares for their emotional sensitivities. This shift in how nurses are expected to deliver care adds flexibility and room for personal contribution in their practice, empowering nurses to develop more holistic and therapeutic care strategies to enhance the prescribed medical treatments. It has been noted that this flexibility of patient-nurse relationships is directly impacted by the nurse's individual ability to reflect on their values and practices and accept feedback regarding performance from their peers. Emerging research shows that nurses who actively seek out this feedback to consolidate their understanding are far more likely to excel in their practice and achieve high performance ratings, more robust ability to adapt to new roles, greater creativity, and overall more considerable satisfaction in their work. Instilling the importance of useful feedback as an essential tool for learning and advancement must then begin at an early education level. The effect that developmental educators can have on the continuing culture of their practice through this medium is exceptionally significant. The simple act of teaching future staff members the techniques of most effectively delivering and receiving feedback allows students to continue the pursuit of elevated patient-centered care techniques. The medium of developmental learning has not always been paramount to the education of nurses. When comparing it to the hands-on skills, Kowalski comments that considerably less time and energy has been dedicated to preparing both educators and learning on how to receive feedback. Kowalski, in her article Giving and Receiving Feedback, Part 1 and 2, writes extensively on both the techniques to deliver best and receive feedback, and attests to how crucial it can be in both the learning process and continued developmental progressions of a nurse throughout their career. However, in this foundation of communication isn't established during the preliminary stages of education, Francesca Dormina notes that interventions into existing workplaces in which seminars are hosted do have an immediately positive effect on the staff and patient experience, showing that post-education learning can be a valid source of further development in nursing practice. Fully utilizing the benefits that feedback can deliver to the nursing practice is difficult at times within the contemporary healthcare environments. They are often fast-paced, and these idealistic methods for providing healthcare at times can fall to the side of delivering immediate treatments, which are at times crucial to the patient's survival. O'Daniel comments that health professionals tend to work autonomously, even though they may speak of being part of a team. Efforts to improve healthcare safety and quality are often jeopardized by the communication and collaboration barriers that exist between clinical staff. When considering this, it is understandable how leaders begin to emerge in these environments organically, categorized by their ability to influence and empower people to achieve common goals. In this case, using feedback to help direct others to improve and maintain a service standard in all medicinal environments. As mentioned previously, one of the key traits which lead to an individual being successful within their practice is health. As mentioned previously, one of the key traits which led to an individual being successful within their practice in health is their ability to introspectively look at their practice and seek feedback from their peers to continue their learning and development. Patient-centered nursing is continuing to grow in esteem throughout Western practices, although the parameters of patient-centered care change slightly between nations. The US and UK are both following. Australia in its example of how patient-centered nursing can become institutionalized and lead to better care outcomes. To remain one of the most prolific practices in the world, Australia must continue to innovate and collaborate with patients to redefine and better our practice persistently.